Hello everyone. Today we'll be seeing the morphology of maxillary. We'll be discussing the morphology of maxillary molars. Molars, as we know, are very important in the whole dentition. They're very key to the occlusion. They're very important for the function of mastication. So maxillary molars, again, plays a very important factor in all these. We'll be discussing the morphology of maxillary molars, mainly maxillary first and second molars. So maxillary first molar, what we'll be discussing first, maxillary first molar is the largest tooth in the maxillary arch. It's the largest tooth in the maxillary arch, which is a crown which is more wider buccolingually than mesiodistally. So generally, the crown of maxillary first molar is more wider buccolingually than mesiodistally. Just four well-developed functioning cusps, namely the mesiobuccal, distobuccal, mesiolingual, and distolingual cusp, and one supplemental cusp of little practical use, that is cusp of Carabelli. Three roots are present, two buccal roots and one lingual root. So this three root and the placement gives a tripod-like effect to provide maximum anchorage. As you can imagine, most of the occlusal forces defaults on the maxillary first molar. From the mandibular first molar, most of the occlusal forces before the maxillary first molar. And so this three root structure, two buccal and lingual structure, provides a tripod-like effect which gives maximum anchorage against masticatory. So first, we'll discuss the buccal aspect of the maxillary first molar. The buccal aspect will have a trapezoidal shape with cervical and occlusal outlines representing the uneven side. They will have roughly a trapezoidal shape. These two sides, the occlusal side and the cervical side, representing the uneven side, with the mesial and distal sides being almost equal in length. So roughly trapezoidal in shape. And here we can appreciate both the mesiobuccal cusp and distobuccal cusp. We can also see parts of mesiolingual and distolingual cusp. The mesiobuccal cusp is broader than the distobuccal cusp. And for each cusp, the mesiobuccal cusp, the cusp lobes meet at an obtuse angle. And for the distobuccal cusp, it meets at right angle, so almost right angle, which makes the distobuccal cusp a much sharper cusp than the mesiobuccal cusp. So mesiobuccal cusp slopes meet at an obtuse angle. Distobuccal cusp slopes meet at a right angle. Part of the mesiolingual and distolingual cusps are also seen from this aspect. So coming to the margins of the way, this is margins of buccal aspect. The mesial outline is merely a straight path downwards. For this particular, this is the right maxillary first molar. So this is the mesial outline, which we can see is a merely straight path downwards and mesially till the crust of curvature area, which will be at about 2/3 distance from the cervical line, close to the junction of the occlusal third and middle third of the buccal aspect, more towards the occlusal third. You can see the crust of curvature, and till that point it is almost straight. Whereas a distal outline, as you can see in the image, will be more uniform curvature with the crust of curvature coming close to the middle of the middle third. This, from this aspect, the cervical line is slightly convex with a convexity towards the root. It's not a predominant convexity. And the occlusal outlines are marked by the cuspal slopes of mesiobuccal and distobuccal cusp. The most important structure present on the buccal aspect is the buccal developmental groove, which divides the two buccal cusps. That is, it will be almost equidistant from the mesiobuccal and distolingual line angles. The mesiobuccal and distolingual line angles, it will be almost at the center of the buccal aspect. It will divide the whole buccal aspect into mesiobuccal and distobuccal cusp. So they will run parallel to the long axis of the distobuccal groove. This buccal developmental groove almost runs parallel to the long axis of the distobuccal groove. It terminates at half the distance between surgeon and the cervical line. That is, it comes close, it terminates around the middle of the buccal surface of the crown. And from this aspect, all the three roots are visible. Mesiobuccal and distobuccal root will be completely visible. Mesiobuccal root will curve distally at the middle third. It will curve distally at the middle third, whereas distobuccal root is comparatively straighter. As we mentioned, its long axis is parallel to the distobuccal root. So they are comparative. The distobuccal root is comparatively straighter, and it curves mesially at about the middle third. Point of bifurcation is about 4 millimeter above the cervical line. The point of bifurcation of the into the buccal roots is about 4 millimeter. The length of the root run from the buccal aspect is about 4 millimeters. Coming to the lingual aspect of maxillary first molar, from this aspect, the gross outline is a reverse of that from the buccal aspect. So they will have they will be trapezoidal in shape again, roughly trapezoidal in shape. And since the distolingual cusp is round as compared to the mesiolingual cusp, it will be smaller and more rounded in shape. The smooth curvature of the distal outline becomes confluent with the cusp. So the distal cusp slope of the distolingual cusp will be confluent with the distal outline. The round distal outline will be like one semicircular curvature extending from the cervical line to the distolingual cusp, almost forming a semicircular arc. The lingual developmental groove is another important structure present on the lingual surface. It's also confluent with the outline of the distolingual cusp. It will be also seen like a continuation from the mesial cuspal slope of the distolingual cusp. And it divides the mesiolingual and distolingual cusp, and it ends at a point in the center of the surface, similar to that of a mesiobuccal developmental groove. Sorry, buccal developmental groove. From the lingual aspect, we can again only lingual cusps are visible from this. Buccal cusps are not visible. Mesiolingual cusp is the largest cusp among all the four cusps. Mesiolingual cusp is the largest cusp, and the width forms about 3/5 of the width of mesiodistal crown diameter from the lingual aspect. From the buccal aspect, the cusps are almost equal width, with the buccal developmental groove coming in almost the center of both the cusps. Here, the mesiolingual cusp is the largest, with the width of about 3/5 the mesiodistal width of the diameter, forming at about 3/5 the total width of the crown. So, angle formed by the mesial outline of the crown and the mesial slope of the mesiolingual cusp is almost 90 degrees. The angle formed by the mesial margin of the tooth and the mesial slope of the cuspal slope of mesiobuccal cusp is almost right angles, and shallow depression extends from the end of the lingual groove. It extends downwards, crosses the cervical line, and ends near the middle third of the lingual groove. This is an important feature we can appreciate from the lingual aspect. A depression which extends from the lingual groove, starts from the crown region from the middle third. It's around the extent from the end of that lingual groove region, extends downwards, crosses the cervical line, and extends towards the middle third of the lingual groove. Another very important structure present in the, which could be present in the lingual aspect of the maxillary first molar, is the cusp of Carabelli, which we have mentioned earlier as the fifth cusp or the accessory cusp, non-functional cusp. This will be a small cusp, which can be a somewhat prominent cuspal structure to a very rudimentary structure. It is usually attached on the mesiolingual surface of the mesiolingual cusp. So it will be outlined occlusally by an irregular developmental groove, which will separate the cusp of Carabelli from the mesiolingual cusp. may be seen as a developmental crease or as a well-developed cusp. And if the cusp is well-developed, it will be sharper than the mesiolingual cusp. It can form a cusp which could be sharper than the mesiolingual cusp. The cusp ridge of this cusp of Caravelle is approximately 2 millimeters cervical to the cusp ridge of the mesiolingual cusp. It's located 2 millimeters apical to the cusp ridge of mesiolingual cusp. The lingual root is conical, terminating in a bluntly root apex. We can see part of all the three roots from this aspect. Most prominently the lingual root, which will be terminating in a bluntly round apex. This apex will be in line with the lingual root. In the buccal aspect, the buccal developmental groove was parallel to the long axis of the mesodistal root. Bucco-distal root. Here it will be parallel to the long axis of the lingual. Mesial aspect, both the mesiobuccal and mesiolingual and the fifth cusp, part of the cusp of Caravelle is visible from the mesial aspect. The mesial marginal ridge is confluent with the cuspal slopes of both mesiobuccal and mesiolingual cusp and is curved cervically. The crust of curvature at the cervical third will be at the cervical third buccally, will be at the cervical third buccally, and lingually it will be at the junction of cervical and middle third. The cervical outline line around is irregular, curving occlusally. It will be a slight curvature of not more than 1 millimeter occlusally, and the contact area at the junction of occurs at the junction of the middle and occlusal third closer to the buccal aspect. A shallow concavity is seen just below the contact area. Usually in the mesial aspect, a shallow concavity is seen just below the contact area. Mesiobuccal and lingual roots can be appreciated from the mesial aspect, and the level of bifurcation is a little closer to the cervical line than that is found in the root buccal. So from the bifurcation, a smooth depression usually extends almost to the cervical line. From the bifurcation area, smooth depression usually extends almost to the cervical line. And the lingual root from this aspect is longer than the mesio root, but is narrow. So the lingual root is longer, but the mesiolingual root is more wider. Distal aspect, the tooth shows distal convergence. As we saw earlier, even from the lingual surface, it was very narrow towards the distal aspect. So it shows a distal convergence. So palatal and buccal aspects are visible from this. The parts of palatal and buccal aspects are visible from this aspect. Distobuccal cusp is slightly larger than the distolingual cusp. Distolingual cusp being the smallest cusp. Distal marginal, which is shorter, more concave, and more cervically placed than the mesial marginal ridge. Cervical line over here is less curved. As you can see, it's more or less straight. And lingual root, distobuccal root, and part of the mesiobuccal root is seen from this aspect. The level of bifurcation is more apical as compared to the level of bifurcation of the mesial aspect. It is located more apical. Or we could say the length of root trunk is more in the distal aspect. Coming to the occlusal aspect of maxillary first molar, the shape of the occlusal aspect is about a rhomboidal shape, with mesial and lingual measurements being greater than the distal and buccal measurements respectively. So the mesial and buccal lingual measurements will be greater as compared to distal and buccal measurements. The tooth is wider, as we mentioned first, tooth is wider buccolingually than mesodistally by about 1 millimeter. And among the four angles, you could see acute angles in the mesiobuccal and distolingual cusp, as well as obtuse angle in the mesiolingual cusp and distobuccal cusp. You can see obtuse angles. There will be acute angles in mesiobuccal and distolingual. The occlusal aspect, we can appreciate all the four major cusps, that is mesiolingual cusp being the largest. Arranged in the order of the size, mesiolingual is the largest, followed by mesiobuccal, distobuccal, and the distolingual is the smallest. And cusp of Carabelli being the fifth cusp attached to the mesiolingual cusp can also be appreciated from this. So, mesiolingual, mesiobuccal, and distobuccal cusp among these are considered as the primary cusp, with distolingual cusp becoming progressively smaller as we go from the first to second to the third maxillary molar. So, mesiolingual, mesiobuccal, and distobuccal are the major primary cusp of the molars, and distolingual is considered as a smaller cusp, secondary cusp, which shrinks in size as we go to the second and third molar. So, this triangle formed by the mesiolingual cusp, mesiobuccal cusp, and distobuccal cusp is referred to as the maxillary molar primary cusp triangle. As you can see, maxillary first molar will have a prominent distolingual cusp, somewhat prominent distolingual cusp, which gets smaller and smaller as we go to the third molar, usually many a times disappearing completely in third molars. So the triangle formed by the three primary cusp is known as the maxillary molar primary cusp triangle, and this arrangement of this cusp in a triangular shape reflects the outline of the root trunk with one lingual root and two buccal. The ridges present in the occlusal aspect involve triangular ridges which extend from the cuspal tip to the center of the tooth. Associated with all the primary cusps, there will be triangular ridges. Oblique ridge, which runs diagonally across the occlusal surface, there will be an oblique ridge which is formed by the distal ridge of the mesiolingual cusp and triangular ridge of the distobuccal cusp. By the union of the triangular ridge of distobuccal cusp and distal ridge of mesiolingual cusp, there will be an oblique ridge which will run diagonally across the occlusal surface. Which is a very important ridge which will help in strengthening the maxillary first molar against more masticatory load. A transverse ridge will be formed by the union of triangular ridges of mesiobuccal and mesiolingual triangular ridges, mesiolingual cusp. So these two triangular ridges of mesiobuccal and mesiolingual cusp join together, fuses together to form a transverse ridge, or an oblique ridge diagonally across the occlusal surface, and a transverse ridge. Mesial and distal marginal ridges form the mesial and distal margins of the occlusal surface. And apart from that, there will be cusp ridges, mesial and distal cusp ridges for each associated cusp. Mesial and distal cusp ridges. Coming to the foci on maxillary first molar, there are two major foci and two minor foci on the occlusal aspect of the tooth. Two major foci being the central fossa, which is marked here as 1. It's the central fossa, which is the largest fossa situated mesial to the oblique ridge. This is the oblique ridge, if you remember. This is the oblique ridge, and mesial to the oblique ridge, you will see the central fossa, which is the first major fossa and the largest fossa, that will be bounded by oblique ridge, transverse ridge, and cusp ridges of the, more specifically, distal cusp ridge of mesiobuccal cusp and mesial cusp ridge of distobuccal cusp, oblique ridge, and transverse ridge. Between these structures, you will see the central fossa. Distal fossa is another major fossa which is found distal to the oblique ridge. Again, this is the oblique ridge, and here marked as number 4 as a distal fossa, which is the fossa located distal to the oblique ridge. And apart from this, there are two minor fossa, which are the two triangular fossa. Now, triangular fossa are triangular shaped region formed with their base of the triangles being the marginal ridges. So, mesial triangular fossa is marked as 2. And distal triangular fossa as marked as 3, with their bases being the mesial and distal margin ridges respectively. The developmental grooves there are a lot of grooves present in the maxillary occlusal surface of maxillary first molar. The central grooves extends mesially from the central fossa region. It extends. This is a central groove. Start from the central fossa and extends mesially over the transverse. It crosses the transverse ridge. Crosses the transverse ridge, extends mesially and ends in the mesial triangular. So this is the central groove. Transverse groove of oblique ridge which extends again start from the central fossa. It extends distally crossing the across the oblique ridge of this. So oblique ridge of maxillary molar and crosses the oblique ridge and moves distally. Distal oblique groove extends mesially from the distal triangular fossa. This is a distal triangular fossa. It moves mesially from the distal triangular fossa along the distal aspect of the oblique ridge and passes lingually, joining with the lingual groove. As we know, lingual groove divides mesiolingual and distolingual cusp, and this distal oblique groove extends mesially and lingually and joins with the mesio and lingual developmental. There's a buccal groove which extends from the central fossa. The buccal groove which divides the buccal aspect into two halves. It starts from again the occlusal surface. It starts from central fossa and it divides, extends between the mesiobuccal and distobuccal cusp and extends into the buccal aspect. And apart from this, there will be a fifth cusp groove. As we mentioned earlier, the cusp of Carabelli will be separated from the mesiolingual cusp by a developmental. So these are the important developmental grooves present in the maxillary first molar. Pits. Pinpoint depressions are seen on the tooth surface. Of pits are seen usually at sites where the developmental grooves terminate or join with each other. Initial pit. So there will be a central pit, which is found in the central fossa where most of the grooves come and terminate. And a buccal groove, central groove, and transverse groove of oblique ridge radiate from this pit. So that's the most important pit. Most of the developmental grooves usually they terminate as a pit. So this is a chronology of the maxillary first molar. Maxillary first molar is one of the first permanent teeth to erupt at around 6 years of age. And the first, it's one of the tooth where there is first evidence of calcification even at birth. Maxillary second molar differs slightly from maxillary first molar in some respects. This tooth supplements the maxillary molar in function. It usually has similar function and it supplements the maxillary molar in its function. Some variations. There is an absence of cusp of Carabelli. There will be no cusp of Carabelli on the mesiolingual cusp. Roots of this tooth are as long as, if not longer than the first molar, and the crown is tilted distally on the root trunk. So these are some of the general features of the maxillary second molar, which are different from maxillary first molar. From the buccal aspect, the factors which are different from the maxillary first molar is compared to the first molar, the crown is a little shorter cervico-occlusally. It will be a little by about 0.5 millimeters, will be shorter, and narrower mesiodistally by 1 millimeter. The buccal groove is located further distally. It's not exactly in the center, dividing it into two equal halves. It is located a bit more distally, making mesiobuccal cusp much larger than the distobuccal cusp. Lingual aspect. The distolingual cusp is smaller and not well developed as in the maxillary first molar. There is no fifth cusp. As I said, the primary cusp triangle, as we go to the second molar to the third molar, the distolingual cusp will become smaller in size. There is no fifth cusp present, and the apex of the lingual root is in line with the distolingual cusp. Here, the apex of the, it's rather than the lingual groove, developmental groove being in line with the long axis of the lingual root as in first molar, here it will be in line with the line bifurcating distolingual cusp. The mesial aspect, the buccolingual dimension is about the same as that of the maxillary first molar. The roots do not spread as far buccolingually, and it's more confined within the borders of the crown, the roots of the second molar. Distal aspect, since the distobuccal cusp is smaller than in the maxillary first molar, more of the mesiobuccal cusp will be seen from this aspect. So that is the major difference in the distal aspect. You will see more amount of mesiobuccal cusp from the distal aspect. Distal cusp being smaller. And the apex of the lingual root is in line with the distolingual cusp. As we saw from the lingual aspect here, also the apex of the lingual root will be in line with the distolingual cusp. Occlusal aspect, most of the features of occlusal aspect which we discussed in maxillary first molars can be appreciated here also, except for the cusp and size of the cusp, which is more similar to that of maxillary first molar. The crown is more constricted. The crown of second molar is more constricted, and there are two major types of crown structures seen from the occlusal aspect of maxillary second molar. First is a rhomboidal type, more similar to the first molar, which will have a more prominent distolingual cusp, and a heart-shaped occlusal aspect where the distolingual cusp is very poorly developed, and the other three cusps, the primary cusp triangle is more prominently seen. This will give a more narrower lingual surface, which is described as a heart-shaped type. So there are two types: a rhomboidal type, which is more similar to the maxillary first molar, and a heart-shaped structure where the distolingual cusp is poorly developed. So another important feature about the occlusal aspect of maxillary second molar is the presence of large number of supplemental grooves. As compared to the maxillary first molar, there will be a large number of supplemental grooves on the occlusal surface, which makes the surface more wrinkled in appearance. So that is another change which we can appreciate in maxillary second molar. So these are the development and dimensions of the maxillary second molar. As we saw earlier, can be slightly smaller than the maxillary first molar, some of the dimensions, and it erupts at an age of about 7 to 8 years. Here, the first evidence of calcification is as late as 2.5 years of age, and it erupts at around 12 to 30 years of age. So, barring for the third molar, this is the second last tooth to permanent tooth to erupt. So those are the important morphological features of the permanent maxillary first and second molar.